In this chapter, we will discuss some occlusion concepts and the classification of malocclusion. Tooth occlude on each other by cusp to fossa occlusion, like in posterior teeth, or cusp embrasure occlusion, which is one tooth occluding on several ones. The anterior centric occlusion contacts is that the palatal surface of the maxillary incisors they occlude on the labial surfaces of the mandibular incisors and canines. This occlusion maintains stability of the jaw and only permit limited movement inside the jaw that is directed. The direction is what we call it the tooth guidance, which means that what are the tooth interaction and contact when movement happen. There are several types. We have what is called a group function, or the cusp canine guidance, the incisal guidance, the condylar guidance. The group function guidance is when there is multiple contacts in lateral or eccentric mandibular movements, but the cuspic guidance or canine is when only upper and lower canine teeth are in contact during lateral mandibular movements. For the incisal guidance, it happens in the incisal region when there is a contact between the anterior teeth during protrusive movements of the mandible. So in specific movements, there is what is called the incisal guidance. In lateral movements, we have the cuspic and the group movement of multiple tooth, especially the posterior ones. For the condylar guidance, this guidance is when both the jaws get separate and the mouth is open. So it is the downward movement of both the condyles along with the slopes of the articular eminence during protrusive movements leading to separation of the posteriors. So it is a protrusive movement also. We hear about the concept of supporting cusps and the non-supporting cusps, or the centric holding and the guiding cusp. What are the difference of these? The supporting cusps are the palatal cusps of the maxillary posterior teeth and the buccal cusps of the mandibular posterior teeth. But the non-supporting cusps, they are the buccal of the maxillary and the lingual of the mandibular. So here we have the supporting are the palatal maxillary and the buccal mandibulary, but the non-supporting is a buccal in the maxillary posterior and lingual in the mandibular posterior. This positioning of the tooth inside the arch, it takes a curve that it starts high from the posterior teeth and goes down until it reaches the anterior teeth. And this imaginary slope is called the curve of Spee. So it is slightly more of straight and slightly convex. It should not exceed more than 1.5 millimeter of depth. But if we look from the transverse aspect, we can see that there is another curve between the tips of the cusps, It is called curve of Wilson, and we can see that the lingual cusps of the posterior teeth are aligned at a lower level than the buccal cusps of the on both sides and in the arches, which means that the posterior mandibular are more lingual, and the posterior maxillary are more of the buccal tilt. Now, what is the criteria to classify that this occlusion is normal or it is ideal? We have some key steps, and we must know it. In the anterior region, we must have what is called the horizontal overlap and the vertical overlap. The horizontal, which we mean it is the overjet, and the vertical overlap, which we call it the overbite. They are defined as the incisal edges of maxillary anterior teeth are labial to the incisal edges of the mandibular teeth. So this is the overjet. The overbite or the vertical overlap is that the incisal edges of maxillary anterior teeth extends below the incisal edge of the mandibular teeth, which means here you can see that the incisal edge of the maxillary anterior teeth is not below the incisal edge of the mandibular, which means that there is some malocclusion in this area. As for the posterior teeth, the buccal cusps and the buccal surfaces of the maxillary teeth are buccal to those in the mandibular arch. The palatal cusps of maxillary teeth rest in occlusal fossa of the mandibular teeth. We said that this is the supporting cusps. The buccal cusps of the mandibular teeth rest in the occlusal fossa of the maxillary teeth. Okay, the lingual cusps and the lingual surfaces of the mandibular teeth are lingual to those in the maxillary arch, which means that the maxillary arch encounter or encompasses the mandibular arch. We must know that each tooth in a dental arch occludes with two teeth in the opposing arch, except the mandibular central incisors and the maxillary last molar. Now, let's study what is called the Andrews 6 case of occlusion, which specify the normal occlusion. We have the first one is the molar relation, which means this relation is the first key, when the mesiobuccal cusp of the first maxillary molar falls within the groove between the mesial and the middle cusps of the mandibular first permanent molar. This is the first aspect of the first key of Andrew. The second is the distal surface of the distal marginal ridge of the maxillary first permanent molar contacts and occludes with the mesial surface of the second permanent mandibular molar, which means the distal of the first permanent molar touches the mesial of the second permanent mandibular molar. Crown angulation, which means this is the crown angulation. This is it. When the gingival portion of the long axis of each crown is distal to the occlusion portion of the axis, which means that the gingival portion of each tooth has a distal inclination and it varies from tooth to another, but it is different from the crown inclination, which is the labial lingual crown inclination. if we take a line that is perpendicular to the cusps of occlusion, that is tangent to the middle of the labial or the labial aspect of each tooth, we can say that there is a tilt, and this tilt what we call it the crown inclination. So this is the key 4, which means that normal occlusion and these inclination is what we see as a whole, the curve of 𝐵. Like each tooth has a specific inclination toward the distal. Axis of rotation is the key 4 of Andrew's normal occlusion key. In order to achieve correct occlusion, none of the teeth should be rotated. Why? Because rotation of teeth will make it occupy more space inside the arch if it was a posterior teeth, and if it was an anterior teeth, it will occupy less space, which means there will be a difference in the arch length and will cause malocclusion. Also, rotated canines may affect the aesthetic and the occlusal interference and lead to occlusal interference because it has a tooth guidance property. Here we can see that the curve of 𝐵 in normal aspect, it is more of a straight, which with a small convex. Here this is abnormal, where it is concave and convex. The 5th key of Andrew is the presence of tight contacts between the tooth and the absence of any spacing is essential to maintain the integrity of any arch form. Flat occlusal plane is what we call it the curve of 𝐵, and as we said, it should not exceed 1.5 millimeter in depth. We will now start with the classification of the malocclusion. It usually happens in the 3 planes: the sagittal, the vertical, and the transverse. And in each plane, you can see some specific malocclusion that can be determined. For example, for the sagittal plane, we can describe the movement of the jaw forward or backward, which means that it studies the molar relationship that we spoke about previously, and if there was any deviation from the first Andrew key of occlusion, we can say that there is a malocclusion in the sagittal plane. And then we will see how we can classify it, whether it is first or second or third later. For the vertical plane malocclusion, which is the height, and we said that is concerned with the overbite of the incisor that we spoke before. We may either have a deep bite or an open bite. A deep bite when there is an excessive vertical overlapping of the upper anterior over the lower anterior of the tooth during occlusion. But the open bite is the opposite, when there is a lack of vertical relationship of the upper and the lower. And the open bite can be anterior and it can be posterior. It is concerned with the width of the arch. If it changed, we will get what is called a cross bite, and when it is defined as when one or more teeth are malpositioned buccally or lingually. The reason for that is that if there is any tiltation in the in the tooth itself, or there is a change in the width of the arch. This is an example of the deep bite, which is what? A vertical malocclusion. An anterior open bite, also it is a vertical malocclusion. We have, this is the cross bite, which is a transverse, and bilateral posterior open bite is also a vertical. This malocclusion can be teeth, or it can be skeletal malocclusion. So how is it classified when it is skeletal in origin? It also classified in the same way that we have a skeletal malocclusion in the sagittal, the vertical, and the transverse plane, and they are classified in the same thing. We have malocclusion, open bite and deep bite in the vertical plane. We have cross bite, and whether it is unilateral or bilateral in the transverse plane, and we have a sagittal plane malocclusion if it was a skeletal here, if there is a forward placement of the jaw, and retrognathism is used for backward placement of the jaw. These are the terms that are used to describe the relationship between the jaw, whether it is forward placed or backward placed. Here is some examples. We can see that this is a skeletal, this is in the sagittal plane, this is in the vertical, and this is in the transverse. They are skeletal in origin. As we know that canines have a guiding property, so there is 3 classifications of its relationship. In class 1, the maxillary canine occludes between the first premolar and the mandibular canine. So this is the class 1. Class 2, when the maxillary protrudes, the canine becomes more medially. In class 3, when the mandibular protrudes to forward, the canine becomes distal, which means that is more to the premolars. It has no longer any relationship with the mandibular canine. Now let's discuss the famous angels classification and know what became what new things that have emerged. The class 1 that we discussed is that the molar relationship, or the first key of Andrew, is what we call it the Angel's class 1 malocclusion, which means that the mesiobuccal cusp of the maxillary permanent first molar occludes in the mesiobuccal groove of the mandibular first permanent molar. The mesiobuccal cusp in the mesiobuccal groove. But if we have, for example, there is a crowding, spacing, rotation, missing tooth, protrusion, midline diastemia, these are all considered class 1 malocclusion. The canine relationship is class 1. The face is divergence is straight. For class 2, it has 2 subdivisions. The first is it is characterized with that the distal buccal cusp of the maxillary permanent first molar occludes with the buccal groove of the mandibular first permanent molar, which means that there is a protrusion. Here we have there is a protrusion. Now the distal buccal, the distal buccal, the distal buccal cusp is occluding with the mesiobuccal groove, and we know that class 2 has two subdivisions considering the incisal relationship. If the maxillary anteriors are proclined, we call it subdivision 1 of Angel's class 2, and if we have at one side the class 1 relationship and in the other side there is a class 2, so it is all considered Angel's class 2 subdivision 1. If we have the same, on one side we have class 2, on the other we have class 1, but the maxillary anteriors are retroclined like this is considered Angel's class 2 division 2 malocclusion. The third malocclusion is when there is a protrusion of the mandible, which means that now we have the relationship became where is it? The mesiobuccal, it has become a mesial relationship now. The mesiobuccal cusp of the permanent maxillary first molar occludes into the interdental space between mandibular first and second permanent molar. Now the mesial cusp occludes in the interspace between the first and the second permanent mandibular molar. There's two types of class 3 malocclusion. It is a real class 3 malocclusion and it is considered skeletal. If it was not skeleton, it is named Zedo class 3 malocclusion. It is mainly due to habit, so it is must be discovered early in development, because it can, if it stayed until until growth is stopped, it will transform to a skeletal real class 3 malocclusion. So we have in this chapter we know the normal occlusion, the ideal, the 6 Andrew case for occlusion. We have seen the types of tooth guidance. We have seen the molar relationship, the canine relationship, the malocclusion, and the classification of Angel. Now we will conclude with a new classification that is called the Ackermann Prophet system of classification, that is more inclusive. It is divided into groups and subgroups. The first one is the first that we assessed the alignment and the symmetry of the dental arch. So in this first group we can see if there is any crowding or spacing. In the group 2, now we can examine the profile that we are studying, whether it is concave, straight, or convex. Then we have group 3. In this group 3 we now specify the malocclusion in the planes. In group 3 we classify the transverse plane, which is concerned with the cross bites. In group 4 we assessed the sagittal relationship, which is the molar relationship. And in And in group 5 we do the vertical assessment, which is considered with the deep and open bite. We have also the if there is any in group 6, in group 6 and 7 8 we see if there is any severe problems that are considered with skeletal, if it was skeletal, or there is combined problems. For example, it is not just in one plane. There is, for example, here the vertical transverse, the sagittal vertical, the sagittal vertical transverse. يعني in all, this is which is considered the most severe is number group 9, which has all the all of the malocclusions that are involved: the profile, the transverse, the anterior, posterior, and the vertical. All of them, they are in the group 9. So they consider that this type of classification has gave us a more profit and a more comprehensive look about the diagnosis. So all of the complexity of the malocclusions are explained in the 3-dimensional, and it gave us a complete diagnosis. Differential treatment planning, we have differentiated whether it is skeletal or a dental problem, and we so it was to overcome the drawbacks of the traditional angels classification. Despite that, there is some disadvantages that did not show the etiological consideration, like the causes, whether it is heredity or environmental. Also that it was only based on static occlusion and did not take in perspective the eccentric movements and the functional occlusion. That's it for today. Salam.